My name is Carmen. I'm 42 years old. I've been seeing Dr. Weber. I feel like it's been 8 years, maybe 10. Originally came in for rhinoplasty revision, and then about a year ago came in for rhinoplasty revision. I had some fainting situation that happens and hurt myself, and then came in. And as I came in to get that done, I thought, why not kill two birds with one stone and get my buccal fat kind of done, and talked about it. And I was a pretty good candidate. I had lost some weight recently and just always had very full face regardless of weight, and always just sort of bugged me a little bit. So wanted to feel a little bit more confident, and so I did. Added it to my rhinoplasty. I think it was maybe like half hour longer than it should have been. I don't know. I was asleep, so it's all the same to me. But yeah. So my main concern with my nose was, well, I fainted and I broke my nose, and so it was completely collapsed and I was unable to breathe. So could not breathe, basically had become a mouth breather. Like I was just huffing and puffing out of my mouth, couldn't sleep, always felt tired. So definitely needed to get it fixed. And this would have been my third time, because I'd originally broken it playing soccer, and then fixed, and then broken again, and then now fixed. So just wanted to breathe, but aesthetically also it was literally collapsed onto its side. So visually not very cute. And then also functionally not functional. What brought me back was just confidence that Dr. Weber knows what he's doing. He helped me out the first time and it was great, and then there was only any issue with it because I had personally fallen on it and made the issue happen. But it would have, I feel like it would have been great for the rest of my life had I not damaged it myself. But yeah, I think just the confidence that I know the staff is really great here, very warm from the moment you walk in to like your surgery day to recovery. I know that everything is just gonna work out. So this time I was a little bit nervous because it was my third and I didn't know what maybe to expect, but gave me confidence before and even right before the surgery, before he got started. There'd be graft to help structure everything, and now I'm breathing like day one. So I feel like as I've done 3 of these now, recovery, the first time I actually had somebody who stayed with me and was there for a few days. I was such a baby, but by the third time, I got everything, and I had my P's and everything that I needed to get done so I could take care of myself. I was a little bit, I guess, didn't know what to expect with the buccal fat. And so I actually had purchased protein shakes and jello and things like that because I wasn't sure how much I was gonna be able to eat. But I actually was eating solid food within like the next day. There was barely any sutures in there. Another crazy thing that I thought is I had a teeth cleaning planned for like a month later, and I thought my dentist is for sure gonna notice something, and she didn't even ask anything. And I thought, oh, she's definitely gonna see some type of suture, like scarring, and she still doesn't know. She has no idea. So I also thought that I was going to be really puffy, and I looked probably very close, like the day of, I looked very close to how I look now. Within a few days, I did get some swelling, and it took a few months to go down, and now it's almost a year in, and but initially right off the bat, this was the look. Obviously I added makeup and everything, but yeah, it's not too far from where it was the first day of surgery.
How do you feel about your appearance now?
I I really like it. I love my appearance now. I feel like this is the way I should have always looked. I really do. I feel like, like I said, when I lost weight, as a woman, your weight kind of tends to fluctuate, but my face always stayed very round. It didn't really matter what the rest of my body was doing. And now I feel like it just matches. Like everything just flows a lot better. It did take some getting used to because of, 42 years of having a somewhat oval shaped face and then seeing, having some nice definition, and my jawline is a little bit more pronounced. That took some getting used to, but I love it. I love what I look like. I feel like it definitely matches the rest of my progress. I feel more balanced, symmetrical. And then for my nose, I breathe just effortlessly now. No more mouth breathing, no more waking up at night with dry mouth. I just feel so much healthier and more beautiful for sure. 100%. Yeah, I'm so glad that I did it. It was probably more work for Dr. Weber than it was for me. All I did was close my eyes and I woke up feeling great and looking fabulous. Well, I know our society, I guess we take a lot more pictures nowadays. And I feel like before, definitely I was like doing one of those where I was, doing like a fish face, sucky face. And now I could just feel more relaxed. Like I don't feel like I'm having to like change my look or pose. I feel like I could just look into the camera and smile and feel like this is it. I don't have to do any extra things. I guess my advice would be, if you're gonna have facial plastic surgery, just remember that it's not reversible. So consider that this is a big change. And if you're going through other changes, maybe be in a good place mentally. Know that it takes time to heal as well. And you should be very patient. You should be a patient because it does take some time. I remember my very first rhinoplasty. My nose was great the very first day, and then the healing process started, and so there was swelling, and I thought, this is not what I signed up for. And every day and every month, every week, month, portion of the year that would go by, it would change a little bit more. The tip of my nose would get a little more refined. You just have to be a patient because it is a process. You have to be patient with your body. It's healing, it's recovering. So definitely that is one thing to consider. And not everything is for everybody. I think that's my next, I guess, tip, advice, is that not everything is going to be for everyone. And you have to trust Dr. Weber because he sees your face from different angles, and he's seen many hundreds, thousands of faces. And so if you come to him saying, I want to look like this, and you have a picture, and he looks at your face, and he could probably be the best judge of saying, what aspects of this do you like? Because you can't put that person's nose on your face. It's just not realistic. So you gotta trust the process, trust Dr. Weber, trust everything. Just Dr. Weber should be your first stop. No, I mean, he's my first stop and my last stop. I don't think I'll ever go to anyone else. I'm probably gonna live in the neighborhood of Dr. Weber for the rest of my life. I'll probably be his last patient because I'll probably want his hands to be the last ones that touch my face because I just trust him so much. He's never led me astray. He's always given it to me straight, including my nose. And I think he's just such a gentle, kind, and thoughtful person. He from beginning to end, from first consultation way back 8-9 years ago to now, just such a nice, thoughtful, kind, and honest person. So skilled. I'm telling you, I hope that some pictures are attached of what my nose looked like to this video because it was a nightmare. And I'm sure that it was a nightmare. If it looked like horrible from the outside. It probably was such a nightmare for him, but he never once made me feel like it was. And he's just such a kind person. And yeah, as I age, I'm gonna trust my face to him forever, because I just know that I'm in good hands, literally.